We're going to talk about gut and gut health. I am Dr. Natalie Gonzalez. I am from Synergy Health and Wellness, an integrative and functional medicine practitioner and a retired surgeon. We present things here that are things that are related to root causes of different types of illnesses that people have. So in this case, we're going to be talking about gut and gut health. And I really want to talk about a healthy balance of bacteria in your gut. This is something in medicine that we have only recently recognized as being essential for people's health, but it really is essential for your mental, emotional health. If you have problems with anxiety, depression, ADHD, or focus, it's really essential for sleeping. So if you have insomnia, if you're having difficulty with blood sugar control, with weight, all of these things are related to gut health. And many of us, especially in the United States, were born into a system of medicine in which we used tremendous amounts of antibiotics. This was our miracle drug for so long. And we used those antibiotics like they were water in many cases for everything. We ended up with a lot of people with a lot of gut problems and essentially other health conditions because of it. We are just now trying, in these last decade or so, trying to back off on that use of antibiotics, because even worldwide it's recognized that we have some major resistance to the antibiotics that we have right now, so that even there are organisms out there that our antibiotics are not going to touch. But even before antibiotics were developed, we were, as human beings, able to get rid of a lot of our own infections and things because of how our body was able to manage that. You know, there's a place and time for antibiotics, but it has really created a problem here. The other reason we sometimes see a lot of gut disturbances in terms of balance of good and bad bacteria is a lot of people being born by C-section. So it's during that birth process that you get inoculated with healthy gut bacteria. So sometimes you'll start out at a little bit of a disadvantage there, but not entirely. So what I tell people is you actually have, first of all, billions of different types of bacteria in your system already, and it's a matter of feeding and fertilizing those that are the healthiest and most beneficial. And the way we do that is fiber. Fiber is the food that our healthy bacteria need in order to thrive. And when we give those bacteria that fiber, they thrive, and the less beneficial bacteria start to diminish. And you'll see the gut start to repopulate and function a little bit better. I have to say, I have been working at this myself for at least 5 years, and it hasn't been until the last few months, I would say the last 6 months, that I've noticed some actual progress with it. And I believe it's because about 9 months ago, I actually switched to a whole food plant-based diet. So I'm not eating meat, dairy, eggs, butter, things like that. Those things don't have any fiber in them to begin with. And I'm eating all the foods that have fiber, which are plants. So plants like fruits and vegetables, of course, have fiber, but also nuts and seeds, legumes and beans and grains. All of them have fiber. So I went from, I think initially when I measured how much fiber was in my diet, I was getting about 15 grams of fiber a day. And in the United States, we average about 13 grams of fiber per day. Although when I have patients keep track of it in a food journal and check it, it is not unusual to see that on a daily basis, they're just getting barely over 4 grams of fiber. 4 is almost nothing. Some of the countries around the world, they easily get 70 to 100 grams of fiber a day. It's not unusual, but in this country, we're really having to work to get people into the 30 to 50 grams of fiber range. But I noticed when I went back and checked what my daily level of fiber was on the current diet that I'm on, the whole food plant-based diet, that I easily average about 70 grams of fiber a day. And that's because all of my meals consist of fiber. They all consist of plants. So in the morning when I have my oatmeal, which has fiber in its own, fiber and protein, I will add chia and flax and maybe pumpkin and sunflower seeds or some nuts. I might add a little bit of wheat germ in there. And then I usually put a little bit of fruit to sweeten my breakfast. So that's my breakfast, and that alone is loaded, probably with well over 30 grams of fiber just from that one meal. For a lunch, I might have a slice of a really heavy whole grain bread, usually one that either I make or there's a place in town here that makes sprouted grain bread, and they don't use any flour in it. And so it is all fiber also. And it's a very heavy bread. They call it rug bread. I think that's a great name for it, but it is a very heavy bread. It's great toasted. You can put avocado and hummus on it, whatever you want. So I have that, and I might have a fruit or a vegetable and hummus with it. And that would be lunch, and that's going to be pretty high fiber also. And then, dinner, same thing. I'm going to have a legume or a grain, sometimes both, and lots of veggies in it. So not hard to hit that 50 to 70 range with those kinds of things in my diet on a daily basis. I really want you to know, when you are trying to increase fiber in your gut, you can take it in extra. And I know for a long time in my practice, I would prescribe probiotics until I started really going through some of the research for it and realized that the research is all over the map about it. And it's partly because we have billions of different types and billions of amounts of these different types. And so when we take a probiotic, it is a drop in the bucket, not to mention the fact that if you are not feeding that probiotic, or if you are not feeding that bacteria that you're taking in, you are essentially pouring your money down the drain, or the toilet for that matter. So what you really want to be knowing and understanding is that healthy bacteria, even the ones that are already in your system, need fiber to thrive. So whether you put it in there or you're just relying on what's already there and you want to help it thrive, the food to feed it is fiber. Okay, it's as simple as that. So don't be spending a lot of money on probiotics unless you're feeding them, and don't be even wasting a lot of money with fermented foods unless you're feeding them also. So fermented foods are going to be things like yogurt, and I know for myself, if I did yogurt, I'd probably either do a soy yogurt or a non-dairy yogurt. So I might use coconut milk for that. But you can do a lot of really good bacteria from fermented foods like sauerkraut and kimchi, especially the ones that are homemade. The ones that come in a can have been processed. So that means that they have destroyed the actual bacteria in those foods. If they come in a container in which sometimes you'll see a little valve where it can release air if they build up a little air in the container while they're fermenting. Things in the refrigerator that are in the plastics may be fermented. It's hard to say. But I have like extra vegetables from my garden this year, and I did this one year in my garden. I actually decided to ferment cabbage that we had. And I have to tell you, it was the simplest recipe. I think it was just a brine of salt and water. I was shocked at the difference in taste of that sauerkraut than what you buy in the store. It was absolutely delicious. It took about 4 weeks to ferment on my countertop, but that's okay. You just keep tasting it once in a while to make sure that it's still okay. But know that the longer it ferments there, you're going to get a much more complex and delicious taste from it. What I find is about 4 big mason jars is a good amount for us, because it only takes 2 to 4 tablespoons a day of adding some fermented food to a salad or something. I usually put a little kimchi off to the side in my salad, or I might put some in the middle. But 2 to 4 tablespoons, a couple tablespoons is fine, of a fermented food. I really want you to be getting out there and experimenting a little. I will be looking all the time for any comments that you have. If you have questions, just Put your question in there and we'll look for those comments and questions and we'll start to answer them as we go along. I hope that you like and subscribe. If you feel like it would help somebody, make sure you just share it with them. That helps our channel, of course, but it really, more than that, helps the other person to maybe hear a different perspective and have a different solution for something going on for them.